Yay! Everything went live at the same time. Wow. That's kind of amazing. And for some reason, I have dry throat today. Welcome back to day 3 of Parasite Week. And today we're going to talk about heartworms, which is kind of a big deal. And people get really activated about this. So I'm going to tell you what not to use. I'm not sure if I have any great options for others, but we'll talk about it anyway. So the big thing with heartworms is that it is absolutely not a one-size-fits-all. Certain areas of the country have really high heartworm load, and other areas of the country have very low heartworm load. And you can go to the heartworm incidence map, heartworm incidence map. If you put that in your search engine, it'll come up. I think the most recent one actually is from like 2019. There may be a 2021 floating around somewhere. And the reason we have those incidence maps is because if a veterinary clinic diagnoses a dog as positive heartworm and they want to treat the dog, they have to order the treatment drugs specifically for that dog. They can't just stock a bunch of heartworm treatment injections in their clinic. And part of the reason it's done this way is, one, so that we don't run out of supply, and two, so that we have the ability to track how heartworms are moving and expanding throughout the country. So heartworms are spread by mosquitoes. And in order for your dog or cat, they're very rare in cats, by the way, and cats cannot be treated with the same medication that dogs are treated. Cats are not the normal host for heartworms. So if a cat gets heartworms, they usually will develop only 1 or 2 worms. And weirdly, the most common symptom for cats with heartworms is vomiting. And they're generally in kitty cats diagnosed on ultrasound, and you actually see the worms inside the heart. So for the dogs, they can certainly have much higher heartworm loads. So a mosquito has to bite an infected dog. And when the mosquito bites the infected dog, it draws up blood. And in that blood are the little immature parasite. Then the parasite has to stay in the salivary glands of the mosquito for 2 weeks. And in that 2 weeks, it undergoes maturing stages. And then the mosquito has to come find your dog, bite your dog, and inject those immature stages. And then those immature stages have to go through a bunch more changes and a migration from where it bit your dog over the shoulder or on the leg or on the face or on the ear. Once it's injected into the animal, it travels throughout the body, it matures, it goes through a lot of changes, and we have multiple larval stages. And eventually, after 6 to 9 months, we will have adult heartworms in the heart. Now, heartworm tests can have false positives and false negatives. False negatives occur most commonly when there's only a couple of worms or there's only one sex of worms. So if you are in a high heartworm area, even if you use heartworm preventative all year round, you still absolutely should have your dog tested for heartworms at least once a year, if not twice. We are seeing resistance in certain areas of the country to the preventatives, which is why they keep trying to come out with newer, bigger, better chemicals, which is very sad. So symptoms of heartworm disease are going to be, at the beginning, nothing. And if your dog only has a couple of worms, it may stay as nothing. But if you have a lot of worms that mature in the heart, eventually they can go into heart failure, liver failure, kidney failure, because it's interfering with circulation, and we'll get heart enlargement. So what you need to do is have your dog tested. And like we talked about the other day when we were talking about ticks, we really like the 40X or the Acuplex test, which does the tick-borne test along with the heartworm test. Now, when I had my practices in New Jersey, a lot of my clients who didn't use heartworm preventative were bringing their dogs in 3 to 4 times a year to have them tested for heartworms and doing that Acuplex test 4 times a year. And the reason they were doing that mostly was my clients who lived along the river, the Delaware River, and they were in marshy areas, high mosquito areas. So they were testing more often. And the reason you would test more often is that it's that long life cycle of the heartworm, that's 6 to 9 months. So it takes so long for it to show up positive on the heartworm test that if you are testing fairly often, every 3 to 6 months, then you are going to catch the adults in a very, very, very early stage. And it makes it much easier to take care of the problem when you catch it early and you don't end up with heart damage, lung damage, liver damage, kidney damage. If your dog does test positive and you want to have them treated, there's 2 ways you can do it. There's the slow kill method, which basically uses a monthly heartworm preventative, and doxycycline, which is an antibiotic. And the doxycycline kills the bacteria that helps the heartworms stay alive. The slow kill method will usually take about a year to have your dog test negative. I use the slow kill method quite often. We didn't have that many heartworm cases in New Jersey, but when we did, we would use the slow kill method most commonly. We did have some clients who opted for the fast kill, which are deep muscle injections of a chemical. And that chemical will kill the heartworms fairly quickly. And the biggest problem that we have when your dog is going through treatment and the adult heartworms die, we've got this dead 12-inch long worm inside the heart, or many 12-inch long worms inside the heart. Where do they go? So once they die, they disintegrate and then they start to break apart. And the reason the dogs have to be kept very quiet for a period of months is that as those worms are dying and breaking apart, we don't want to have an embolus. We don't want an embolism or a blood clot to form in the lungs or anywhere else in the circulatory system. So that's why it's really important to keep your pet quiet, because if, let's say, they have their heartworm treatment, it's been a couple of weeks, and you're thinking, oh, we're good. I kept him on the leash for a couple of weeks. I'm going to let him outside. He's been fine. And then he takes off running, and then he comes back coughing, out of breath, collapsing, turning blue. You've got an embolus. They can survive it, but a lot of times they don't survive it. So as far as preventing heartworms, well, a couple of things. You've got to keep mosquitoes away from your dog. And again, it depends where you live. Do you live in an area, a rural area, where there's a lot of stray dogs, where there's a lot of outdoor dogs, where people may or may not take good care of their dogs? Are they, tied on a chain outside, eating dry kibble, not getting any attention, and infested with fleas, heartworms, intestinal parasites, ticks, everything else? If they don't have a good immune system, they're going to have a really hard time dealing with this. And usually what we would find is that if we had a heartworm positive dog, they were also going to have ticks, they were going to have fleas, they were going to have many intestinal parasites. It all kind of goes together because these are animals with a crappy immune system. There's a great video that I saw on YouTube. Maybe we can find a link at some point. But there's a great video where in a laboratory, they took a blood sample with heartworm in it, with the little baby ones that are injected into the dog, and the immune system attacks it. And it's kind of a time-lapse photography where it literally shows the white blood cells coming in and just coating this thing and literally disintegrating it. So a healthy immune system, that's what it's going to do. If your pet doesn't have a healthy immune system, it can't do that. So that's when we end up with heartworms, or if they just have an overwhelming exposure. So if you were going to use heartworm preventative, and this is I go into this a lot more in depth in our ebook download. So if you have more questions about it, there's a lot more information in there about the treatment methods and what you need to do if you have a heartworm positive dog to get them ready for that treatment protocol. Things that I absolutely want you to avoid if you are in an area where you feel that you really, really need to use some sort of heartworm preventative. And what it's doing is it's not preventing your dog from being exposed to heartworms. It's killing. So it's a parasiticide, just like all these other chemicals we've talked about. It's killing those migrating larvae when they're in certain stages. So they go through multiple stages and it kills a couple of the stages in the middle. So what it does is it hopefully kills those larvae off so they don't ever develop into mature heartworms. So the preventative that you're giving is preventing maturation to adult worms. It doesn't do anything to the adult worms. So the most dangerous ones on the market are Trifexis, which is a combination of milbemycin and spinosad. And I do like milbemycin. I just don't like that combination because it causes seizures commonly. Probably more seizures with that particular combination than any other parasiticide on the market. Let's see. The statistics that we have as of April 17th, 2021, Trifexis had 190,802 adverse reactions reported and 5,998 deaths. So that was as of 2 years ago. And as we keep saying, only about 1% of reactions get reported. So we know we have 6,000 that they have absolutely linked, plus 191,000 adverse reactions reported. So if we multiply that out, that's a lot, really a lot. So, and particularly if you have a dog who has epilepsy or has seizures, you absolutely do not want to use this product. And the other product that I really want to warn about is moxidectin, which is in ProHeart 6 injections and ProHeart 12 injections. Moxidectin as ProHeart 6 injection, which is a 6-month-long heartworm preventative. So you go in, your dog gets poked, and poof, he's protected against heartworms for the next 6 months. When that drug first came out, it killed so many dogs and put so many dogs into liver failure, caused seizures, all kinds of problems, that it was actually taken off the market. And we know how hard it is to get the FDA to actually stand up and say, oh, we might have a problem here. They did. They said, oh, we might have a problem here. And they took it off the market. The sad news is that within a couple of years, it came back on the market. There were no changes. Same thing, same drug, same injection. What they did is said that veterinarians have to give this little handout to the client that explains the potential side effects of the use of this injection. And the client has to read through that, kind of like when you go to the pharmacy and you pick up your prescription and they hand you the thing and it has all the side effects to look for and what to watch for and, you know, in drug interactions, that sort of thing. I have yet to talk to anybody who was actually given that piece of paper to sign saying, yes, I okay this. You're not getting it. And then the veterinarians were also told to be a lot more choosy about which pets got it. For instance, old dogs, maybe dogs with elevated liver enzymes, maybe dogs with liver disease, maybe dogs with kidney failure, maybe not a good thing for them. Maybe dogs with seizures, maybe not a good thing for them. Yeah, I don't think we're being picky enough. So that's the bad news on that one. But it gets worse because they just came out with ProHeart 12 recently. ProHeart 12 is the same exact drug, moxidectin. They tripled the dose because we didn't have enough side effects at the single dose. They tripled the dose, and now it's good for 12 months. Please, 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 do not opt for that. It is convenient. That's lovely. You put it in. There's no antidote if they have a reaction, and you can't get it back out. That's the problem with anything long-acting that you inject into the body. Can't get it back out. So please, please, please avoid those. And certainly things like, I think Simparica Trio and Revolution Plus, they're for heartworm prevention, but they also have isoxazolines in them, and we know how I feel about those. So I don't need to beat that drum again today, I don't think. So my choice for heartworm prevention is going to be plain milbemycin, which is ivermectin, not ivermectin plus. Plain Interceptor, not Interceptor plus. Milbemycin, plain Interceptor. And on that packaging, it will say prevents heartworms, roundworms, hookworms, and whipworms. There's nothing else added in. That just is what milbemycin does. Somebody had a question about that earlier today. And the other one that I would consider using would be our old standby ivermectin, which is Heartgard. It's very, very difficult to find plain Heartgard. It's almost always Heartgard Plus, which has parental pamoate in it, which is an intestinal dewormer for roundworms and hookworms. Do we need that? I don't know. But here's the thing. If you live in a high heartworm area, like the South where it's hot and humid, you probably also live in a high roundworm and hookworm area. I will say that whipworms, and we'll talk about, and you know what, I'm going to save that for when we do intestinal parasites tomorrow. So what you want is you don't want things with add-ins. You want plain ivermectin or plain milbemycin. And if you can't find those products on the market, they actually can be compounded for animals, because most of these heartworm monthly preventatives are flavored. So they've got some beef flavoring or a chicken flavoring or something in them. And some animals that are highly allergic will react to that. So we used Wedgwood Pharmacy in New Jersey. Any veterinarian in the country can use that. And we would have the tablets compounded with no flavorings. And they were effective that way. A lot of people will dilute the cattle ivermectin dewormer. Be very, very careful doing that. If you are off on your dilutions, off on your dosing, you can kill your animal. Ivermectin is an okay thing at the proper dosing. It is a really bad thing at the wrong dosing. Okay. Imagine giving your dog 6 or 12 heartworm preventative pills all at one time. Exactly. Like I said, at the proper dosing, they're fairly safe. But I've had dogs that just can't tolerate any of them, patients that just can't tolerate any of them. And I have a lot of people all over the country who don't use heartworm preventative. Like Karen Becker said last Sunday, I am never going to be the one who tells you don't give your dog heartworm preventative, because I don't know your dog's exposure. I don't know where you live. I don't know what the dogs in your neighborhood are like. I don't know how much time your dog spends outside. My dogs spend very little time outside. They get brought in when the mosquitoes come out, because I come in when the mosquitoes come out. We don't hike in the woods. Mosquitoes live in shady areas. We actually have ceiling fans on our outside porch, because if the flies start coming around or there's any bugs, we turn on the ceiling fans and they go away. So it's all about it's all about protecting them. Okay, tomorrow we're going to talk about intestinal parasites. There is a product I will mention. There is a product called HWF, stands for heartworm free, that is advertised as a natural heartworm preventative. It doesn't kill the migrating larvae like the Interceptor or Heartgard do. What it does is it's strengthening the immune system and the circulatory system. I have never seen a good challenge study with that product. There's a lot of anecdotal evidence from people saying, I've used it. I've never had a heartworm problem with my dogs. Okay, I don't use it, and I never had a heartworm problem with my dogs. So this heartworms are so deadly if you get a major infestation and you live in a really high risk area, that I'm a little more on the fence with that one. I have chosen not to give my dogs heartworm preventative, but that is certainly an individual decision that each person has to make based on where you live, what the exposure is, and what your dog's lifestyle is. Okay. Everybody have a great day, and I'll see you tomorrow. We're going to talk about worms. My dog's got worms.